Hi dear doctors, welcome to Kids Covery. Myself Dr. Parv Luthra and we are discussing pediatrics. The topic of discussion in today's class of pediatrics, Fanconi Syndrome. So Fanconi Syndrome is actually a rare disorder. It's not very common, but I have seen one or two competitive exams asking about this question. So let me just describe this. That it is characterized by wasting of phosphates, characterized by wasting of glucose, amino acids, bicarbonates by the proximal renal tubular. So what happens actually, say in the PCT, okay, if I draw this tubule, if I just draw this, so this is your PCT and PCT has got sodium potassium ATPase pump, okay, sodium potassium ATPase pump that is responsible for absorption of, glucose, amino acids, urea, okay, so all these things are going to get reabsorbed here, even the phosphates also, okay. So if this sodium potassium ATPase pump is not functioning properly, okay, that leads to what? The decreased absorption or decreased reabsorption of phosphates, glucose, amino acids and bicarbonates, and of course that leads to what? That leads to reduced ATP, and sodium potassium ATPase activity can further leads to the decrease in amount of all these things. Now, what are the causes? So, the most common overall cause of Fanconi syndrome is cystinosis. Okay, so accumulation of cystine that is responsible of, in fact, all these things are responsible for destruction of this ATPase activity. Okay, destruction of this ATPase activity is going to be done. Cystinosis. So remember that Fanconi syndrome, okay, Fanconi cystinosis, okay. So let me write Fan, C-O-N-I, Fanconi, so C-O-N, so C-N-O, okay, I, so can you see, very similar. So cystinosis and Fanconi you have to remember. And of course, some metals are also responsible for destruction of sodium potassium ATPase pump, like the Wilson's disease, in which you have got excess amount of copper, and the heavy metal toxicities also is responsible for doing the same. Some medications are also responsible for destruction, like the expired tetracycline. Now, expired tetracycline has been asked as a previous year question, so please be a little more vigilant. Now, because you have destroyed, what you have destroyed? You have destroyed your sodium potassium ATPase pump and everything. I mean, the sodium, the phosphate, the glucose, amino acids, urea, they are not getting reabsorbed and they are going. That's why there is polyuria, polydipsia, dehydration. Calcium is also lost, so bone deformities will be there, and of course, the growth is also going to be impaired. Okay, so there will be some skeletal deformities like rickettsia. The rickets and the osteomalacia. So I combined rickets and osteomalacia as rickettsia, but it's not the case. Rickets as well as osteomalacia. The key finding is going to be failure to thrive, okay, and urine is going to have elevated glucose, amino acids and electrolytes, and serum will show hypokalemia, hypophosphatemia and metabolic acidosis, okay. So what is the treatment? You have to replace the lost electrolytes like potassium and phosphates, and of course bicarbonate supplements are given to correct the metabolic acidosis. This metabolic acidosis is also important when it comes to Fanconi's syndrome. Okay, you got it. So this is all about the issues of Fanconi syndrome, and I thank you so much for being with us. Thank you.